Okay, so I have Donna in my chair and we're going to start treatment. I'm going to first start off with my assessment tools, which is my probe and my explorer. So grab my mirror and my probe. So since I categorize my patient as having generalized moderate periodontitis, I did document all her probing depths. I'm just going to show how I would use my probe. So I would make sure that I'm holding it in the C-shaped grasp, making sure that I have a firm fulcrum, and inserting the probe into the sulcus using short walking strokes and making sure that I stay in contact with the tooth. All right, and now I will be using my Explorer, and this is going to help me feel for deposits so I could remove them with my ultrasonic and my curettes and sickles. So making sure that I have the modified pen grasp, my middle finger is on the terminal shank so I could feel for deposits, and I'm going to fulcrum 1 to 2 teeth away, and starting at that distal line angle, go subgingival, my wrist, using my wrist activation and rolling into the interproximal area. Again, starting at that distal line angle and going subgingival, wrist activation, and rolling into the interproximal area. Okay, and after I'm done detecting for deposits, I would first go in with my ultrasonic. I chose my moderate to heavy ultrasonic because of the amount of calculus that my patient has. So with my ultrasonic, I would make sure that I have a steady mist and a drip, making sure that I don't come in contact with that the tip doesn't come in contact with the tooth, and I will be using my suction as well, and I will be using back and forth strokes and coming in to the interproximal area, coming in and out. Again, making sure that I have a firm fulcrum. Again, using back and forth strokes and coming into the interproximal area. And on the lingual, I would use my mirror, using my indirect vision. I would use back and forth strokes, coming into the interproximal area, making sure that I'm continuing to suction, coming into the interproximal area. Okay, so once I am done going in and deplaquing and removing some deposits, I'm going to go in with my instruments to make sure that I got all of the deposits that I have detected. So I am going to start off with my 1112. This is my area specific curette. This is for the mesial surfaces. So I would make sure that I am using the correct working end, making sure that I am ending parallel to the long axis of the tooth. And as I am inserting the 1112, I want to make sure that I am underneath the deposit and that I start using short biting strokes. So starting at that distal line angle, I'm going to be coming in contact with that deposit, making sure that I have a strong fulcrum and using those short biting strokes and coming into the interproximal area and coming down. Now for the lingual aspect, I would go ahead and flip, and then again, starting at that distal line angle, coming underneath the deposit and using my wrist activation, short biting strokes into the interproximal area. Okay, So now I will be using my 1314. This is my area specific curette. This is for the distal surfaces. So again, I would want to make sure that I am starting at that distal line angle, coming underneath the deposit and using short biting strokes, making sure that I have the modified pen grasp of strong fulcrum, rolling into the interproximal area, and staying parallel. So starting at that and making sure that I'm using the correct working end as well. So setting my fulcrum, starting at that distal line angle, going subgingival, coming in contact with that calculus and rolling into the interproximal area, ending parallel. And for the lingual aspect, I will flip my instrument, having a strong fulcrum, starting at that distal line angle and ending parallel to the tooth. Okay, and once I'm done using my posterior curettes, I will use my anterior curette. This, you are able to go subgingival with this instrument. Again, you want to make sure that you come underneath that deposit and use short biting strokes, making sure that I am using the correct working end. So starting at that modified pen grasp, strong fulcrum, and starting at that midline, coming underneath these the gingiva, the sulcus, I'll be using short biting strokes and ending parallel, coming into the interproximal area. Then I would flip, making sure that I'm up on my fulcrum, starting at that midline, coming underneath the gingiva and coming into the interproximal area. And for the lingual aspect, again, starting at that midline, going sub, using short biting strokes, and ending parallel. Flip my instrument, starting at that midline, and ending parallel. All right. So now I have my anterior sickle. So this is for any supragingival deposits that I can see. So I'm going to start on the mandible. Normally I would have my patient's chin down, but with this Typodont I am not able to do so. So doesn't matter which end I use. So I would, again, making sure that I am holding it in that modified pen grasp, a strong fulcrum, coming up on my fulcrum and starting at that midline and making sure that the tip third is in contact with the tooth. And just rolling into the interproximal area. And again, starting at that midline, coming up on my fulcrum and rolling into the interproximal area. And for the lingual aspect, again, starting at that midline and rolling into the interproximal area, ending parallel. And ending parallel. Okay, now my last instrument that I will be using is my posterior sickle. Again, this is for any deposits that are supragingival. So let me go ahead and turn my patient, making sure that I am using the correct working end. Okay, so starting at that distal line angle, making sure that I have a firm fulcrum, holding my instrument and the modified pen grasp, and just using short strokes, coming parallel, ending parallel, and coming into the interproximal area. And for the linguals, I will go ahead and flip the instrument, starting at the fulcrum ring on the buccal aspect of the tooth, starting at that distal line angle, and just making my way into the interproximal area, ending parallel. So after I'm done scaling, I will go ahead and sign up for before I sign up for my final check, I will polish the teeth with a medium to fine grit Profi paste. It all depends on how many stains my patient has. And so after I'm done polishing, I will sign up for my final check, and my band instructor will come and make sure everything is good. Once I am done with that, I will sign up for restorative. Once restorative is over, I will apply my 5% sodium fluoride varnish. I will make sure that the tooth surfaces are dry, and I will apply it on the facial, buccal, incisal, occlusal, and lingual aspects of the tooth. And that's all I have for today. Thank you.